This video will focus on your sexual health and birth control. It is important to know what to expect when you resume sexual activity following delivery. You will decide when it is right for you to resume sexual activity. However, we recommend waiting at least 6 weeks to allow your body to heal from delivery. While you may have no physical issues when you resume sex, it is very normal to have decreased sex drive. This can be due to changes in how you view your body, lack of sleep, or lifestyle changes associated with having a new baby. Open communication with your partner will be very important during this time. You may also notice physical changes, such as vaginal dryness or pain with sex. Lubricants or vaginal moisturizers, as well as choosing positions that can allow you to have better comfort, may help. If it continues to be bothersome, let your doctor know. Pelvic floor physical therapy may also be helpful. You can learn more about pelvic floor physical therapy and how to schedule an appointment by pausing the video to scan this QR code. Birth control may be the last thing on your mind since you just had a baby, but it is important to realize that you can ovulate and become pregnant even before your next period. We recommend waiting at least 18 months before your next pregnancy. Becoming pregnant earlier than that can increase the risk of preterm labor, delivery, and your baby having to go to the NICU. To prevent a short interval pregnancy, there are several types of birth control which are safe and effective. There are birth control options with and without hormones. We will review the non-hormonal options first. Reversible daily options are great for people who do not want to have any implants, take any medications, or have surgery. One option is abstinence or not having sex. This option does not work for all people. Natural family planning is also an option. This consists of creating a calendar and calculating your most fertile days. This method is 100% effective if used correctly. However, studies have shown that with typical use, it is only 76% effective, and we do not recommend this for those with irregular periods. If you desire to use this option, you should wait until after your first period because it is impossible to know when you will first ovulate after delivery. Condoms are also a good option, but it requires using them correctly every single time you have sex. They are about 87% effective, meaning about 13% of people will become pregnant when using this option. The copper IUD is the only hormone-free, long-acting, and reversible option for birth control. This IUD can provide birth control for up to 10 years, but can be removed earlier if you want. This method may make your periods heavier or cause more cramps, so we don't recommend it for those who already have heavy or very uncomfortable periods. Your doctor can place the IUD at delivery or at your 6-week postpartum visit. If you had this placed at delivery, be sure you have a pelvic exam at your postpartum visit to ensure it is in the correct place. This is a very effective form of birth control, and it is 99.2% effective at preventing pregnancy. If you are sure that you are done having babies, you can also choose to have a sterilization procedure performed. This is a permanent procedure that cannot be reversed, and it is 99.5% effective at preventing pregnancy. For females, this includes a bilateral tubal ligation, or getting your tubes tied, or having your tubes removed altogether, called a salpingectomy. Your doctor can perform this at the time of a C-section, 1 to 2 days after a vaginal delivery, or in about 6 weeks. Males can also have a sterilization procedure called a vasectomy. It is a quick office procedure and is actually more effective than tubal sterilization and has a faster recovery. If you desire this option, have your partner speak to his primary care doctor about where it can be done. There are also several hormonal birth control options. The first of these is the progesterone-only pills, also known as the mini pills. These are up to 99% effective with perfect use, which means taking them at the same time every day. It can be difficult for some patients to remember to take a pill every day, especially with a new baby. Consider setting an alarm on your phone or placing the pills next to something you use every day, such as your cell phone charger or your toothbrush. The next option is the Depo-Provera injection, a shot that you would get every 3 months. People using this method may have irregular bleeding, no periods, or about a 5-pound weight gain. Depo-Provera is about 96% effective at preventing pregnancy. Next up are the hormone-containing, long-acting, reversible birth control methods. The Nexplanon is an implant placed in your arm with a quick bedside procedure using local numbing medication. This can be done for most patients before being discharged. Otherwise, it can be placed at your 6-week postpartum visit. The Nexplanon lasts for 3 years, but it can be removed earlier if you'd like. It is 99.9% effective at preventing pregnancy, which is more effective than having your tubes tied. Irregular bleeding is a possible side effect. The levonorgestrel IUD is a hormone-containing IUD lasting anywhere from 3 to 8 years, but it can be removed earlier. This type of IUD is 99.2% effective at preventing pregnancy. Your medical team can place the IUD at delivery or at your 6-week postpartum visit. If you had this placed at delivery, be sure to have a pelvic exam at your postpartum visit to ensure it is still in the correct place. This method may make your periods lighter or go away altogether, but some patients still have their normal periods. If you have a question about any of these methods or desire to learn more information, please talk to your doctor. Thank you for watching this video about your sexual health and birth control options. Please continue on to the next video to learn about what to expect when you go home after delivery.